Bismillahirrahmanirrahim. Welcome to my lecture number 12, lecture number 20. So, dear students, in this lecture, we will discuss about the nurse roles, especially an epilepsy patient. As in previous lecture, we have already discussed about the anti-epileptic drugs which are used in the treatment of epilepsy, the treatment protocols, the pathophysiology of epilepsy, but today the topic which I am going to explain, that is the basic nursing roles in the epilepsy patient. So what are the precautionary measurements which must be applied during such circumstances? So first of all, it is the major responsibility of nurses to protect from the injury by removal of the sharp objects. As the nurses, they are also responsible to prevent the patient fall by providing side rails which should be padded, and remove the pillow or ease the patient to the floor if possible, especially an epileptic like condition, so the patient become unable to control himself. So it becomes the major responsibility of the nurses that the nurses can protect the injured persons by removing of sharp objects and prevent the patient from falling by providing side rails which should be padded, as well as to remove the pillow or ease the patient to the floor if possible. Another responsibility of the nurse is the nurse is responsible to remove the secretion by suctioning to prevent the asphyxia and to keep the airway clear. Turn the patient to the side lying position to help in draining the pharyngeal secretions. Another core responsibility of nurse regarding epileptic patient, that whenever a patient who has epilepsy, so how the nurse is responsible, he or she should never leave the patient alone, because there may be chances of fall, especially the patient shouldn't be restrained during the seizure attack. So it means that never leave the patient alone. Another major responsibility of the nurses is whenever a nurse is going to administer anti-epileptic agents, so do not insert anything in the patient mouth. It is also it should be also taken considerations. While another responsibility of the nurse is he or she should close. The observation should be kept on the conscious level and note the fluctuation up and down in the mood and attitudes. As well as the nurse is responsible to administer oxygen as advised by the physicians or medical practitioners. As well as the nurse is responsible to loosen the patient clothing from the around his or her necks. After the seizures, put the patients on one side to prevent the aspirations. These are the responsibilities, especially the health teaching should be given to the patient and his or her family for long-term care and follow-up regarding the following: to continue the medication as per physician's advice, teach the patient and family regarding side effects of the medicines. I think, as per myself, whenever you are going to treat the patients, so before treatment you should keep a proper psychological hold on that patient. So when the patient is psychologically satisfied, so it means that physically he will be already satisfied. So to continue the medication as per the physician advice, to teach the patient and family regarding the side effect of the medicines. The second one is care must be provided during the convulsions, especially during epileptics condition, to prevent the further injury, especially tongue bitings, and not restraining the forcefully during the convulsive phase. As I have already told you about this condition, that the patient is unable to control himself, so then it becomes the responsibility of the nurse to provide special care during convulsions, to provide the further injury, as well as because there may be chances of tongue biting, and not to refrain forcefully during the convulsive phase. Proper nutrition should be provided to prevent the malnutrition, and it should avoid the stimulants. Stimulant should be provided. So another core responsibility of nurses, they are responsible to remove the stigma attached to the condition, and he or she should carry an emergency medical identification card or wear an identification bracelets. Counseling should be done, and counseling of the family and patient should be done regarding the type and nature of epilepsy, need to follow the treatment regime for the life or as the physician advises, teach the families and the patient to avoid fear and participate in social and recreational activities. I mean that, let's suppose if a patient who is epileptic like condition, seizure like condition, so I mean that you will have to provide a socially proper environment to avoid the peer and participate in the social and recreational other activities. Because especially in such like conditions, the patient become unable to control himself, so you will have to provide special care and special attention to the patient. You should also instruct the patient to avoid the excessive stimulants such as bright light by wearing dark glasses or covering the eye from the glare with hand if possible, so if nothing is available. Also emphasize the regular follow-up, which I have already mentioned. These are the references, Parquet Textbook of Preventive and Social Medicines, 18 editions. Does, so you can find out all these items in there. Thank you so much. So this is lecture number 20 regarding the nursing roles, especially in epileptic patients. Thank you so much.